Let's talk about how health insurance works in the United States. Americans love to choose, so there are a lot of different types of plans and different companies. Now, Medicaid is a special plan paid for by the government. We're not going to talk about special healthcare plans. We're going to talk about just average plans that average Americans have, like through their jobs, or they can buy through, Obamacare or whatever. So, first of all, let's talk about the cost because it's not usually free for most Americans. Usually you have an option, for example, Plan A or Plan B. There is a premium or cost for your insurance plan. You can buy a cheap insurance plan, for example, $300 a year if you're single, or $1,000 if you want a family plan, or you can buy a more expensive plan, like $800 if you're single, or $3,000 per year if you have a family plan. Now, if you buy a cheap plan with a cheap premium, with a low premium, if you get sick or you need to use your health insurance later in the year, you'll probably need to pay more of that cost. But if you buy a more expensive plan, then you'll probably pay less. So it's kind of a trade-off. Now, this premium, usually it comes out of your paycheck each month. So you might not even notice or even know that you're paying a premium. But most insurance plans do have some kind of cost. So what does it cover, you're asking? Well, preventative procedures, those are procedures and tests just to make sure you stay healthy. Diagnostic procedures are when you think you have a health problem. Also, you should know what a coinsurance or copay, that is a small amount of the bill that usually you need to pay, like 20%, for example. So, preventative exams and lab tests are usually free, or you just need to pay a small copay. Also, basic doctor visits are usually free or with a copay of maybe 20%. So for example, an annual exam, a physical for sports or school, a mammogram screening, for cancer. Vaccines are usually free. If you have a small problem, like you have a sinus infection and you need an antibiotic, you'll probably just need to pay the copay. If your child's sick, take them to the doctor. Again, you probably just need to pay a small copay. So what if you have a bigger problem? So for example, you need maybe a diagnostic test. You have a serious problem. You need an MRI or something. And again, diagnostic cancer tests, or special MRIs and x-rays. Maybe you cut yourself and you need stitches, or you break your foot and you need to go to urgent care, or for a more serious problem, you get an ambulance, call an ambulance, or you have to spend some days in the hospital. That can be really expensive. So that's where the deductible comes in. This is the amount that you need to pay first, and then the insurance will work. So first you pay your deductible, then you'll only need to pay about, 20% of the rest, or your copay. So for example, here are the two plans. The cheap plan, Plan A, has a higher deductible. So if you actually need to use your insurance, you have to pay more. If you bought an expensive plan, you won't need to pay as much if you get sick or you need to use it. So So you need to pay that amount first before the insurance will work. All right, so what about major surgeries or cancer? Because this can be, $50,000 or more. Fortunately, your plan probably has some kind of out-of-pocket maximum. So that means if you have, say, this kind of deductible for your plan, $1,500, you won't need to pay more than $6,000 per year. So if it's more than that, they will not charge you. So maybe a family plan, you might have $12,000. All right, so can we do an example, you're asking? Yeah. So let's do some examples of care, cost, and what you pay. So maybe in January, you go to the doctor for your annual checkup, and it costs $234. Maybe this is free with your plan because it's preventative. But the doctor also orders a blood test, and the bill for that is $432. But you only pay a copay, which is about 20%. So you have a bill for $86 for the blood tests. Then you want to get a vaccine, a tetanus shot, because it's been 10 years, you need another one. You go to the pharmacy and it's free. So you pay nothing and you don't even get a bill. I don't know. Maybe you will, but then you cut yourself while you're cutting onions in the kitchen. Ouch. Oops, you cut your finger. You need to go, or your hand, and you need to go to the doctor or go to urgent care to get stitches. The bill for that is, oh my goodness, it's $534, and you have to pay the whole thing. What? Why? Remember, you have to pay the deductible first. You have to pay the first $3,000 before that will work. All right, you get really sick later in the summer and you have to spend 5 days in the hospital and it costs $18,000. Whoa. So you need to pay this amount, $2,380, and then the rest. So remember the deductible. You've only paid $86 and $534. So you still need to pay the rest of the deductible. Then you have your copay of 20% of the rest of the bill. So that's the remaining $3,620. So kind of expensive, but you don't have to pay the entire $18,000. So later, you come home from the hospital, you're feeling better, but you need to get another MRI test to see if you're actually better still. And the cost for that is $1,760, but you don't have to pay anything. Remember, you have an out-of-pocket maximum. Maybe it's $6,000, so you don't need to pay any more because you've already paid $6,000 that year. What an expensive year for you. This hospital stay really was expensive, but you did have insurance, so you didn't have to pay the whole thing. So what about your health insurance? So it's important to know these numbers. Make sure you know what your copay or coinsurance is. Is it like 10%, 20%? Maybe you have zero. I don't know. Maybe you bought a really expensive plan or a really good plan and you don't have that. Most people do. Know what your deductible is. Know what your out-of-pocket maximum is. And also, by the way, know what hospitals and doctors are in the network for your health insurance policy. You can find that on the internet, on the website for your health insurance company, because it's a lot more expensive if you go to a doctor who's not in your network. All right, so for example, if your deductible is $3,000 and your out-of-pocket maximum was $6,000, you want to try to save that much money. It might be hard, but it's a good thing if you can save at least the deductible so you have that much money to pay for health expenses. And of course, healthcare, all these procedures can be really expensive. Here are some examples of different procedures and types of care and how much they cost. So hopefully you have a good insurance plan to help pay for this. And remember, medical bills usually come weeks or months after, so don't be surprised when you get the bill in the mail. Well, I hope everyone stays healthy.